Hello, my name is Joy O'Mandy, and today for pharmacology class, I'll be discussing noncompliance, what it is, the issues that arise from it, why patients seem to struggle with it, as well as different strategies that can be implemented in order for it to stop being such a issue amongst patients. So to begin, what is noncompliance? Noncompliance, simply put, is when a patient is prescribed a treatment or medication and they refuse to take it or they refuse to finish it. Also, under that umbrella would also be them not taking it correctly. And so, with noncompliance, patients often do run into risks from that. But before touching on the risks, I do want to kind of go over the reasons for noncompliance. Typically comes number one, the cost of treatment. So, depending on the kind of illness or the ailment that they have, defines kind of treatment that they receive. And unfortunately, everyone doesn't have great health care or even with insurance. Some treatments seem to be capped or they're not as easily accessible or cost affordable for the patient. So if it's too expensive for a patient, too much of a financial sacrifice, then a lot of times that's a major point of why noncompliance happens. Not because they don't want to take it, but because it financially hurts them to take the medication. Also could be a denial of the problem. Naturally, some people do not see their illness or their ailment as severely as it is suggested by a healthcare professional. Everyone is not able to embrace or accept their diagnosis. And so if a person has something like diabetes or some other type of ailment and they feel that they are being misdiagnosed, then that will discourage them from actually taking the medication prescribed in order to fight against whatever it is that they're suffering from. Another great reason why a client or a patient might be non-compliant would also be previous experience. If they have fought an illness before, an example could be a cancer patient, they might have had it prior. It could have come back in another form, and a similar regimen or medication is prescribed. If they believe the first time it was not successful or did not yield the results that they were looking for, it can also discourage them from delving into the regimen a second time, or even giving it another chance based off of their prior experiences. Also, apathy is also another reason where you might see noncompliance. Just simply the client not taking it, not saying they don't take it serious, but just not seeing the regimen or the prescription as important. They don't find it to be valuable. And for that reason, because they don't value what's being prescribed, then they make the decision not to engage with the prescription in any way, shape, or form. Another major thing, which comes from even personal experience, is the side effects. If a person's dealing with an illness or ailment that's already chronic or harsh, they might feel discouraged or, again, not engaged with the medication just because they see the side effects are bad. So if they're already nauseous and pain, and then the side effect is migraine headaches and joint pain, then they may decide just to go without it just to avoid any more uncomfortability outside of what they're already experiencing. Another and last point would also be the difficulty of the regimen. Some prescriptions and some therapies, some regimens offered might be too complex or too much to keep up with. Some ailments or diseases might call for more than one pill at certain times of day, and for some clients that might be too much of a hassle or too hard to juggle, too much to understand, too much to weigh out amongst their daily routine, and that can also cause them to be non-compliant with their prescription. When a patient decides to be non-compliant, there are many risks to that. 125,000 people every year pass away due to this issue. Unfortunately, 10 to 25% either end up in the hospital or even in nursing homes because they do not take their medication properly, or they decide they're not going to take it at all. Most sorrowfully would be that there have been patients that have passed away, or on a little bit of the lighter end, they make their ailments worse. They progress them, or they cause others to come about due to the lack of care of the initial issue. As a healthcare provider who completely understands the not wanting of man-made medications, because I myself am not necessarily a huge fan, but in those instances of prescriptions, I would, as far as a main strategy of dealing with clientele, just let them know the facts. Let them know the facts of what can happen if they decide to be non-compliant with the medication, the importance of why this prescription happens. Even if I have to partner with them and go a holistic and medicinal route, then just to at least get them to have some type of compliance, then I would rather meet them somewhere in the middle to ensure that they're still going to take the regimen, but that they don't feel as if it's just being forced on them is not necessary. But most importantly would be representing and showcasing the research to them about their specific ailment and why it is indeed important that they don't skip out on days, why they don't miss the scheduling of it, why they don't just let it go completely or decide to give up, because there's always another way. If they find the regimen to be too difficult, then I'll let them know. Just come back and we'll find something easier. If there's too many side effects, there's always another option. But it's better to keep continuing until the regimen changes than to quit altogether. So thank you for watching my video, and I hope that it was informational for you.